Hello everyone, I am Dr. Sanath, consultant neurosurgeon at Renova Hospital, Kompally. Today I am in front of you to speak a few words on the topic of head injury. As we know, we are encountering more and more number of accidents in our daily lives, either on the road or in our homes. So whenever we have a situation where we encounter a person who has had a hit to the head in the form of a road traffic accident or a fall at home, the first important thing we have to assess about the person is whether he is conscious or not, whether he is able to understand the situation he is in, the surroundings he is in, and to respond to the surroundings and the observers. So whenever we find a person who has had a suspicious head injury, we have to ask a few words whether he is able to understand where he is and how he is and the date, time and place. If we find anything that is suspicious in the form of a incorrect response, we should be suspecting him to be having a head injury. Most common things we have in head injuries is dazedness or confused state. Either it may be for a brief instant or it may continue for a long time. If the patient is a little more is having a severe injury, then either he will be semi-conscious or unconscious and significantly increasing the risk of head injury and brain injury. So whenever we find a person in such a situation, we should ensure that he is out of danger initially, removing from the situation which is the cause of the injury, making him lie down flat, immobilizing him so that any other injury might not be exacerbated, and try to assess the presence of any airway obstruction, whether he is able to respond to our commands and whether he has a pulse or a heartbeat going on, and initiate CPR in the immediate as a requirement. So whenever we find the initial assessment to be stable, we have to assess him for the severity of head injury. Try to ask him a few questions which are common knowledge and try to assess his status. And we can always observe subjectively like the size and equality of the pupils, probability of weakness of the other limbs, and the presence of an external head injury is one more indication of the severity of the injury. So when we find an external obvious head injury in the form of a bleeding head injury and exposure of the underlying skull, it has to be an emergency to be taken the utmost care and transferred to an immediate nearby healthcare hospital or a clinic, where he will be assessed by the receiving doctors and given a score called the Glasgow Coma score or the GCS. A normal person having 15 and total lowest score being 3, whereas the person having anything between 13 to 15 will be a mild head injury, anything between 8 to 13 will be a moderate head injury, and anything below 8 up to 3 is a severe head injury. When we suspect a patient having a low GCS score in the form of a moderate or a severe head injury, the patient has to undergo immediate CT scan followed by assessment by the neurosurgeon, so that he might be admitted for further evaluation and care. If the patient is having only a mild head injury, either the patient can be observed in the general ward for a 1 day or 24-hour period for other symptoms developing at a later stage. So the most important thing will be the further development of new symptoms like loss of consciousness, seizures, vomitings, for which management should be medical and further evaluation as needed. And upon the evaluation being done, if the patient has a large intracranial bleed or a depressed fracture, he has to be undertaken for a surgery as an emergency to save his life as well as improve the quality of life after the recovery. Whenever the patient has undergone a surgery, the patient needs ICU care for a few days followed by rehabilitation and further medical and surgical and as well as physical rehabilitation as well as occupational rehabilitation for full recovery. Thank you.